right, so before I go into my patient's room, who is Paul Brown, I'm going to double check that I have the correct solution. It's 0.9% sodium chloride, which is on his MAR, and the doctor has ordered a new IV start. Hi Paul, how are you today? My name is Amy, I'm your student nurse, and we're going to do an IV start. So I'm going to take a look at your sites, pull back these very nice comforters. Did your wife bring this in? That was sweet of her. Can I get your name and date of birth? Paul Brown, January 2nd, 1980. Great. So I'm going to take a look at your sites. I'm going to take off your armband real quick. And I see that you don't have any allergies. Is that correct? Great. So I'm going to take a look at your wrist and your hand because that's the most distal part of the body. And it doesn't look like you've had any starts there. And those veins look really nice and straight for me. But I'm going to flip it over and look at that antecubital site. A lot of curvature in there. I'm going to start actually the most distal part on that wrist, okay? Great. I'm going to cover you back up while I prime my primary line, okay? So what the doctor ordered is that 0.9% normal saline, and that's just because you're a little dehydrated and we want to make sure that you've got enough fluids, okay? So double checking again with my MAR, 0.9% sodium chloride, making sure that the solution is nice and clear like it's supposed to be, that the expiration date is correct, and the proper amount. I don't have to wipe these off with alcohol because they were capped. And I'm going to make sure that my line is nice and locked as I prime it. I'm going to straighten these guys out. I'm going to hang it so that it's easier for me to handle. I'm going to take it nice and slow so that there aren't any air bubbles. Through. Prime all the way until the end, and I get some saline solution, which I will dump in my garbage. Just a few drops amount. I'm going to cap that back on. And loop it through here so that it doesn't touch the floor, but it's ready. All right, Paul, let's get that IV started. Going to prep my saline lock first. This is what we connect to that primary line that I just hung. Have you ever had an IV before, Paul? No? Okay. So that needle is going to feel like a little sharp poke, and then when we push this saline through, it's going to feel nice and cool. All the way through, good. got all my things over here. First, I'm going to start by placing a tourniquet on your arm. It's going to be pretty tight and uncomfortable, but I won't keep it on for long, okay? I just need to puff up those veins. Good. All right, so we are using that lower hand. I'll place some gloves on. Probably would have placed my gloves on before I did the tourniquet, just so that there's less discomfort in the patient for a less period of time. But for the sake of the video, we're not. I'm not doing a complete sterile procedure gloving because we're protecting me from the patient's blood just as much as the patient. All right, I'm going to take this alcohol prep pad first to put it on this site. Do some nice circles. And then I'm going to take this betadine. You don't have a betadine allergy, do you? I didn't see one on there. No? Okay. So I'll crack this and do nice tight circles to big circles on that site. And I'll let that dry. All right, Paul, we're using a 20 gauge needle. If you don't like needles, you can look away. Otherwise, if you don't have a problem with it, you can go ahead and look at the site. I'm going to pull the patient's hands back, her fingers back as I poke. Feel a slight poke with my bevel up. Good. I would put my needle in a sharps container, which is right there. And I did get some return, which I'm excited about. I'm going to flush. It should feel pretty cool. Good. Flush about 5 milliliters through. Before I place my clear right over that needle site. Going to place the date and time sticker right on the clear portion of my IV site. And undo your tourniquet. I would have undid his tourniquet before I flushed, so I'm going to flush again 2 milliliters to make sure that goes nice and through. Good. Alright, I'm going to place a chevron. Tape placement so that it's nice and tight and secure. How's that feel, Paul? I don't see any puffing in the vein or anything coming out, and the patient doesn't feel pain, so it's a great site. Alright, I'm going to unhook my saline lock. Make sure that it's locked. Now we're going to hook up that primary line, okay, Paul? I'm going to clean off my hub. Straighten out my line. Make sure it's locked. Uncap. And lock. Now going to, before I unlock, going to tape the saline lock portion so that that part stays nice and secure. I'm going to unlock the saline lock and start his drip rate. I'm going to check his MAR to make sure that the drip rate is correct. And I'm going to start by counting the drips per hour. And that rate is correct. All right, Paul, I'm gonna cover you back up. Your bed rails are up, your bed's in the lowest position. Here is your call light. Make sure that your bed is locked. Good. All right, so if you have any questions, I'm gonna come back in just a little bit to make sure that this is running correctly. If you have any questions before that, don't be afraid to press that call light, okay? Thanks, Paul. So now I document on his MAR that I placed a 20 gauge needle with a 0.9% saline solution with the drip rate.